I'm Mike Eisenberg, director of Two Errors Human, a patient safety documentary that was released early 2019. And we've had the opportunity to screen it all over the country and in actually 15 total countries. But we've had screenings at hospitals and universities, and I've had the opportunity to speak on behalf of the film and share my perspective on patient safety, which has evolved tremendously over these last few years, making the film and then releasing it.
So can you tell us more about the documentary? And as you alluded to, what are the most interesting or surprising things that you learned in the process of making the film?
Well, we started making the film in 2015 as a short documentary about patient safety, but more importantly, about the Agency for Healthcare Research and Quality, which my father was the director of until he passed in 2002. And I knew his impact in healthcare, and especially in terms of quality, was massive. And a lot of people had great respect for him, but I had never really dived in and looked at it myself. And I knew it had been about 20 years, where we were approaching 20 years of the original Two Errors Human report. And I wanted to know, well, how far has the healthcare community come? How far does it have to go as well? But I wanted to explore that not through the lens of negativity, not through the lens of gotcha journalism and documentary storytelling, but actually combining a look into the people who are actually working hard to improve it, as well as how patients can get involved. We tell Sue Sheridan's story specifically in the film, and we learn about her struggle as a mother of a son who experienced a medical error and the wife of a husband who died from a medical error, but how she's transformed her life into one of advocacy. And those two angles, I think, merge really importantly in a way that people can move forward with, not look backwards as much. And I think that's always the key to things like this, and was really the message we wanted to get across to people. And I to be honest, I'm thrilled, but also surprised by how well it's been received by the medical community, because when we released it, we were a little nervous and anxious that it wouldn't be received the way we intended it, but it was. And the number of screenings speaks for itself, but more importantly, the people who watch it always kind of walk away with a sense of there's so much we can do, and they want to do it. And I can't ask for a better result from a film like this. Documentaries are designed to inspire change, and to do that through a positive lens is so much more inspiring and rewarding than the other way.
And so, speaking of medical community, when you were in San Antonio and Austin to do some screenings, there was a special guest from the medical world who was important to you. If you could tell us about what happened.
Yeah, we screened this film so many different places, and actually in all of those locations, there seems to be somebody who knew my father, whether it was through the grapevine or through a very personal experience. And oftentimes those were Pennsylvania or DC, places where my father actually worked. And although he had impact in many, many ways, in many places, but I was very surprised when we screened in Texas and found out that Ken Shine was going to be there, because that's a name that's come up in the past in my own life as a conversation point of somebody who my father both admired and worked with. And I don't think I had met him before the screening, and we got a chance to meet and talk. And most importantly, I think hearing him talk about my father after seeing the film and being reminded of all the work that my father did, but also being proud of the film itself and being proud of my involvement in patient safety, is this small little thread that always just makes me feel so proud of the film, and also proud of the amount of work we put in, because I feel closer to my father every time I talk to somebody like Ken Shine. And the fact that somebody of his caliber and his experience in patient safety loved the film and thought it was effective in its goals, that's high praise.
That's great. So tell us, what does the Weezie's Angels recognition mean to you, Mike?
I've always admired Laura Townsend ever since I was first made aware of her and her efforts, and connecting over the screenings. The more I learned about the foundation, the more I came to admire those efforts as a whole. But when I learned about the Weezie Award, I was kind of in awe of not just the award itself, but the motivation behind it, bringing joy, bringing positivity, and thinking about the people who are making efforts to improve patient safety, but also, being a positive force in healthcare for change. And for me to be recognized as that is such an honor, and I'm so grateful that that I'm seen that way and that the film is seen that way, because like I said earlier, that was really the goal. Create awareness, but in a way that inspired positive change and forward momentum and not negativity and looking back. So I feel like, I'm grateful to be considered for this award, but even more grateful to be able to say that I'm receiving one.
So Mike, in your opinion, what's the single most important thing that a patient or a family member can do to help ensure a safe experience in the hospital?
Well, that's a question I think people need to ask before they walk into a hospital setting as well. It's always great to have a list that somebody who's experienced this, somebody who understands how impactful a patient advocate can be, has created. Like what the Louise Batz Foundation has. And these exist, but at the end of the day, it's about executing it and having the confidence to do so. Walking into making this film, I didn't know anything about patient safety. Yes, my father was John Eisenberg, who many people have great admiration for in his role. But as his son, who wasn't originally interested in healthcare, I didn't know a lot of the stuff that he was passionate about and that have actually saved lives. And as I learned those things in making the film, I became not only somebody who wants to practice that if I'm ever in the unfortunate situation where I need to, but also as somebody who wants to share that knowledge with other people. And I think one of the most important things people can do is share what they understand, what they know. Because if you just experience this yourself, that's going to be the saving grace for you or your family member, your loved one. But you can save so many lives by sharing your own experiences and helping other people to, catch something before it happens, whether it's a medication error, whether it's a communication breakdown. I mean, you have 2 eyes, 2 ears, and a mouth, all of them, if they're working, or somebody who has the ability to use any of those tools, just one of them will save a life. But if you're really listening and looking and speaking up when you're in a healthcare setting as a patient, you can actually make a huge difference. But you have to be confident enough to do it. You don't have to be right all the time. You just have to be present.
And a film like yours can do a lot to create awareness and inspiration. And I think you've already touched on some of this, but what inspires you to continue learning about efforts to improve patient safety and to keep engaging with people on this topic?
Well, after making Look, I'm a filmmaker. When you make a documentary or anything of that, for that matter, sometimes you make it, you release it, you move on to the next thing. I have yet to want to move on to the next thing. Am I making other projects? Yes. But I am still neck deep in patient safety. I'm speaking. I'm taking every opportunity I can to screen the film and hopefully talk about the film afterwards. The reason why I'm doing that is not because of some obligation as the filmmaker to defend it or to be present for it, but because whenever I'm part of that conversation, whether it's an event or a one-on-one, I am reminded of how much people do care about this topic, but how difficult it is to actually start a conversation about it. Because whether there's a national pandemic, or whether there's just, quote unquote, bigger fish to fry. This is always at the forefront of every issue in healthcare. Patient safety is there. And we need to make sure we don't lose track of that. And I feel like storytelling is one of the best ways to do that. And sharing your story, but also being part of a conversation And when I'm screening the film and talking about it, I see the passion in people's eyes. Whether there's 5 people in the screening or 500, there's always people who want to talk. After the film, before the film, whatever, they want to talk about the ideas they have or the ideas the movie gave them. And that passion bleeds through, and it makes me want to keep going, makes me want to keep sharing the film and never giving up on patient safety in whatever way I can contribute. And hopefully that's by creating awareness. Well, I just wanted to thank everybody from the Louise Batz Foundation and Laura for thinking of me, especially, and staying in touch and keeping this conversation going and allowing me to stay part of the activities in the foundation. I'm really honored. Honestly, this is one of the best awards I can think of receiving. I know as a filmmaker, people make jokes about the Oscars or whatever. I was never thinking about the Oscars for this movie. I was just thinking about making a difference and creating awareness. And for a patient safety awareness foundation to see the film as a success and to see me as an extension of that and to award me this honor, I'm grateful and I won't forget it.